My name's Dr. Jason Page, and I'm the Clinical Director of the Targeted Lung Health Check Programme for South Yorkshire and Basset Law, and also a GP by background. I'm here to talk to you today about Lung Cancer Awareness Month, which is the month of November. So I'd just like to spend a few minutes to explain a little bit more about lung cancer. So, lung cancer is a disease that affects many people. It's one of the most common cancers in the United Kingdom. But like all cancers, if you pick it up early, you have a better chance of surviving and a better chance of a curative treatment with surgery and chemotherapy and the like. So the first one is a cough for 3 weeks or more. Any cough that lasts 3 weeks or more should be checked out by a healthcare practitioner. A change in cough that you've had for a long time. So if you have airways disease such as COPD or emphysema or asthma, if your cough changes, and people with those conditions will know what their cough is like normally. If it changes, take further medical advice. A chest infection that doesn't get better, or if you keep having chest infection after chest infection, that again should be checked out. If you're feeling breathless or wheezy for no reason, if you cough up blood, really important to get that checked out. And then other symptoms, chest or shoulder pain that doesn't get better. And if you have a hoarse voice for 3 weeks or more, these can all be symptoms of early lung cancer. So it's really important to get them checked out. And finally, a more general symptom, which is that of weight loss. If you're losing weight and you can't explain it, that may not be specific to lung cancer, but it's certainly a concerning symptom, and it should always be checked out. And some of the times you may not need any treatment. Most of the patients with these sort of symptoms don't have lung cancer, but have a chest infection or some other type of problem that needs dealing with. But if there is a suspicion of lung cancer, then something like a chest x-ray might be organised. But the first thing is get an appointment and have a discussion and an examination to decide what best to do. One of the things we're doing to try and pick up lung cancer even before people have symptoms is with targeted lung health checks. Targeted lung health check includes having a questionnaire with a nurse, and then around half of people are recommended to have a CT scan. And that CT scan can pick up lung cancers very early and then allow those patients to have treatment and further investigations. I think finally, the last thing I want to say is just be aware that if you do have known respiratory symptoms, make sure you follow up on your checks. If you have COPD or asthma, have your annual checks with the nurses in the GP practices, or attend your hospital appointments as needs be. It's really important that we keep on top of the difficulties and these illnesses to give us the best chance of picking up cancer especially, but other conditions earlier. Thanks very much for listening. Have a lovely day.